During a recent interview, Dr. Nancy Woods shares a little bit of her background in regards to dissociative identity disorder, also known as DID.
I've been a nurse, and so I worked with several clients who had DID in the hospital. They would come in and they wouldn't quite know how to manage themselves.
After working with DID clients for 5 years, Karen Ogden, a marriage and family therapist, explains how uncommon DID is, especially within her scope of practice.
I mean, it's so rare, so I've had probably 4 clients with DID and a couple others that I suspect. There's usually anywhere between 4 and 20, probably 4 and 15 active personality states that a client can fluctuate through. And they all perform different functions, and they all respond differently to different treatments.
Dr. Woods briefly discusses how DID can have multiple diagnoses and how it can mask other mental illnesses.
There's multiple diagnoses of schizophrenia, and they might have been medicated before, delusional disorders, lots of different sorts of diagnosis like that.
Dr. Woods goes on to explain the variations between both mental disorders and how they can be misdiagnosed for schizophrenia.
Well, for schizophrenia, the reason that people would be diagnosed with that is because they say they hear voices. For schizophrenic people, voices are often outside their head. For DID people, the voices are generally inside your head. For PTSD, it is a form of PTSD, in my opinion, because the incidents happen to cause them to split, and it is a way to cope with what happened to them.
Ms. Ogden provides insight on the ultimate goal when working with her clients.
It's basically what the client wants. So sometimes they don't want to get rid of the personalities, they just want to function better. And so the most risky thing with DID, and there's no two cases that are similar. And then the goal of therapy really is to take all of the memories that were repressed or stuck and feed them back to the adult mind and process them as an adult. And that starts the integration process.
During our interview, Ms. Ogden discusses ways for her clients to communicate effectively among each personality.
Sometimes let's keep a journal, and if parts need to go or come or share information, if they're not communicating in their head, let's write it in a journal or keep it on your phone.
When an individual experiences traumatic situations, it enables the person to create alternative solutions. Each personality reflects a different trauma.
So sometimes you can have fully functioning parts that are capable, and they have names and personalities and functions, and they have ranges of emotions, and then you can have other parts that are just kind of fragments. Because when you have trauma, it's like a glass shattering, and bits and pieces go everywhere, and parts can be like a little shard of glass, which is a half of a trauma that they remember.
Ms. Ogden explains some of her experiences while witnessing one of her clients switching from one personality to another.
One client that would come, when she would come up, she would turn my picture so it was crooked, and I knew which one it was. And with another one, her face would literally change to appear childlike. Her eyes would get big. When people are switching, their pupils dilate, so the blacks of their eyes almost take up the entire eye, which usually happens when someone's in fight or flight or in real danger. Even though there is no danger in my office, they still act as if they are. So it's just patience.
Ms. Ogden shares various techniques when communicating with her clients. However, the methods and treatments utilized during session will vary depending on the therapist.
A lot of drawing, because sometimes you're dealing with parts who are pre-verbal. I've had parts that are 2, 3, 4, and they don't talk or don't like to talk, or they can't write very well. So we draw pictures, we sit on the floor, we play with Play-Doh or sand tray therapy. We read books. I read books for a long time to get to know a certain part before she would talk. treat everyone a little bit differently.
Dissociation can take place at any time, no matter the stress level. It is important to remember that there are many forms of dissociation, DID being one of the few disorders.
It does exist, but there's a lot of foundations and groups that have been formed to discredit. But if you sat where I sat, there'd be no doubt that people can have lots of parts.